this as the state reports 862 more COVID-19 cases and 51 more deaths. Here's the governor.
With us, you had, dare I say, countless Hoosiers keeping you and your family in our thoughts and our prayers. From all that I've learned about your father, he was a remarkable man, and what a incredible husband and father and grandfather with 2 Indiana University degrees. I know that when you have 2, you become kind of a sports fanatic, but not very many of them go on to write a book about their fanaticism. But he did. So we've been thinking a lot about you and your family.
Thank you, Governor. Thank you for all the well wishes. I appreciate that.
You want to give your report? You've been on the ground now a few hours. back in the fray.
Thank you. Today we reported 862 additional cases of COVID-19 in Indiana, which brings to the total count 21,870, the number of Hoosiers known to have COVID. This does include cases from the VA and federal correctional facilities located in Indiana, as someone asked yesterday. Unfortunately, we also saw 51 additional confirmed deaths. To date, 1,264 Hoosiers have died of COVID-19, and another 113 are believed to have died from this disease based on their symptoms, x-rays, and other diagnostics. But we did not have a positive COVID test on record for those individuals. Yesterday, someone noted that Indiana has the highest number of deaths per capita among states that are starting to reopen and questioned our approach. What I want to emphasize is that we would expect to see more Hoosiers severely impacted by COVID-19 because our overall health metrics as a state for things like smoking, diabetes, high blood pressure, and obesity are higher than many other states. And those are the risk factors for severe illness from COVID-19. This is why counties like with the highest numbers of cases and deaths and rapidly increasing numbers like Marion, Lake, and Cass County are not reopening in this first phase. And that's why we're taking a measured, phased-in approach as we continue to review the data for each county every day. Part of the data we look at includes our ICU bed and ventilator availability. Both are staying at steady levels with about 41% of ICU beds and just over 79% of ventilators available today. Of the ICU beds in use, just over 19% are being used for COVID patients, while about 9% of ventilators are being used by individuals with COVID. We also are looking at increased testing to better understand just how prevalent COVID-19 is in Indiana. Today marks the first day of testing at 20 statewide sites as we've launched in partnership with Optum Serve. If you have symptoms of COVID-19, or if you are at high risk because you're over the age of 65, you have diabetes, obesity, high blood pressure, or another underlying condition, or if you're a member of a minority population that's at greater risk, please come get tested. You do not have to be symptomatic. You can register at https, and you can see that on the website here, or by calling 888-634-1116. I want to make sure that everyone has this number, as it's an Indiana-specific number that helps people wanting to register avoid longer wait times. And if you're having troubles getting registered, please just go to one of the sites that's listed on the map at our coronavirus.in.gov website. These sites are open from 7 a.m. to 7 p.m. through Friday this week and will resume Monday through Friday schedules next week. We'll also be adding another 30 sites to the list in the coming days. As we test more, we will find more positives, and that's where our expanded contact tracing comes in. Today, we're training the first wave of contact tracers for our new centralized approach that begins on Monday. More than 1,700 people have expressed interest in these critical jobs, and nearly 150 people are part of the training that started today. We will have additional trainings in the coming days. We chose Maximums to run this effort because they are already running the ISDH COVID call center and were able to add these duties immediately. They have been an incredible partner throughout this response, and we're grateful to have someone who could launch this so quickly. We've also been working hard for the last few days to distribute PPE to hospitals, long-term care facilities, EMS, and emergency management agencies. We have made more than 300 distributions totaling more than 2 million pieces of personal protective equipment across the state. We're working on guidance for facilities such as dental offices as they reopen and hope to have more to share on that in coming days. Finally, we're pushing out training to facilities about the new Battelle Decontamination Center system, which will clean N95 masks up to 20 times. I'm excited to report that more than 40 facilities have already registered to participate in this program, which will go a long way toward extending the life of PPE and keeping our workers and healthcare individuals safe. Thank you.
Thank you, Dr. Box. COVID-19 has had an impact on every single Hoosier's life in one way or another, and certainly our homeless population is no exception to that. Oftentimes they're looked over or around, but not because of your efforts. You're doing exactly the opposite. So can you give us an update on some of the efforts that you've undertaken, and then you've got some other guests that you're going to pull into the conversation as well?
Absolutely. Thank you, Governor. Responses to disasters must have provisions specifically for marginalized individuals and groups. Those groups may suffer disproportionate consequences, and the COVID pandemic is no different. Hoosiers who struggle to be heard can be left behind without someone to amplify their voice. One of the many areas that we identified early on in our emergency operations was that individuals experiencing homelessness were at risk for significant negative impacts without a safe and secure place to shelter for isolation and quarantine. As I explained several weeks ago, we set out to work with local hotels, homeless providers, and healthcare teams to identify locations and staff where individuals experiencing homelessness or those who didn't have a safe place to isolate could complete their quarantine. We were able to start the project quickly here in Central Indiana and rapidly expand statewide through our partnership with the Indiana Housing and Community Development Authority. We matched programming to areas of greatest need based on data. By using a formula based on the percentage of homeless according to the most recent point-in-time homelessness count, which is an effort undertaken by IHCDA and homeless serving organizations to count the number of homeless individuals on every single night, every January. The Fort Wayne, South Bend, Evansville, and Bloomington areas have similar numbers of homeless individuals, so we began our expansion there. Broad, multi-sector coalitions that include homeless serving organizations, mental health and substance use disorder treatment providers, and local governments oversee operations across the state built on lessons learned from the first 5 sites. In Marion County, that January count was 1,567 individuals, including 273 children. There were 3,904 individuals in the balance of the state, including 817 children, an increase of 9% over the previous year, for a total of 5,491 of our fellow Hoosiers experiencing homelessness. I'd like to share a few numbers with you from our Central Indiana Safe Recovery site. Our first day of operations was Sunday, March 29th. The total clients served since that time are 252. We've had 167 successful discharges. 113 clients were connected to an appointment for primary care. 27 total clients were connected to an appointment for mental health. And we've successfully connected 5 clients to long-term supported housing. Because of the ability to immediately refer COVID positive or symptomatic individuals experiencing homelessness from shelters directly, from emergency departments, and from local health departments, we have effectively prevented an additional level of public health crisis by avoiding COVID outbreaks in homeless shelters in Indiana. Additionally, we have effectively reduced the number of individuals that would have likely had worsened symptoms and ended up in our hospitals without this intervention. We are lucky to have a guest with us today from the flagship model of the Safe Recovery site, Dr. Ashley Overly, a psychiatrist, CEO of the Sandra Eskenazi Mental Health Center, and faculty member of the IU School of Medicine Department of Psychiatry. Her quick and steadfast partnership has been absolutely extraordinary. Dr. Overly, welcome. Can you tell us a little bit about your work at the Marion County Safe Recovery site?
Hi, Dr. Sullivan. Thank you. I really appreciate the opportunity to speak with you today. We've been honored to participate in the Safe Recovery site, and I'm happy to have the chance to talk about it. The Safe Recovery site was established under the direction of Governor Holcomb in partnership with FSSA, ISDH, the Division of Mental Health and Addiction, and the Marion County Public Health Department, as well as the Sandra Eskenazi Mental Health Center. The Safe Recovery site has been established to provide a safe, voluntary quarantine or isolation location for vulnerable people who otherwise do not have a safe place to stay. Our primary focus has been on serving homeless neighbors with the goal of providing a safe discharge disposition from hospitals and emergency departments to help limit the spread of COVID in homeless shelters. We are grateful to note that we've been able to accommodate all referrals from Marion County homeless shelters, and so we have had additional capacity to also accept victims of domestic violence, DMHA residential sites, group homes for individuals with developmental disabilities, and COVID patients who have high-risk family members at home but are unable to effectively quarantine in their home. We opened Sunday, March 29th, and since that time, we've served 252 individuals. We receive referrals from all major hospital systems in Marion County, homeless shelters in the Marion County Public Health Department, as well as those specialized residential sites serving vulnerable populations.
It's really extraordinary. What would you say are a few of the highlights of this work from your perspective?
Well, we've been able to accept large groups of COVID-exposed individuals, sometimes up to even 53 people at one time, from homeless shelters that otherwise might have had to close or stop taking new admissions in order to limit the risk for COVID outbreaks. So we've enabled those homeless shelters to be able to stay up and running and continuing their operations. During their stay, guests at the Safe Recovery site have access to nursing services and primary care and mental health services if needed. The clinical team at the Safe Recovery site includes Eskenazi Health staff from the Sandra Eskenazi Mental Health Center and primary care. We check in with guests every 3 hours to make sure that they're doing well and that their needs are met. Some have engaged in needed primary care or mental health or substance use treatment for the first time while at the Safe Recovery site. So during the guest's stay in the program, the Safe Recovery site staff work with the guest to ensure that they have a safe place to go when they are discharged. We've connected 140 individuals to appointments with primary care and mental health treatment.
Awesome, thank you. As you've worked through this process, which has been really complicated to get all of these different pieces in place, transportation to and from site on staff, or staff on site, PPE, what would you say would be the keys to creating these types of successful partnerships?
So the Safe Recovery site truly has been a real community collaboration. It's required support and partnership from a wide variety of community institutions, including the Marion County Public Health Department, the Indianapolis Emergency Medical Services, the Marion County Office of Public Health and Safety, FSSA, DMHA, and others. We at the Sandra Eskenazi Mental Health Center feel truly honored to be one of many partners that has come together to make this a success. We really feel like we're making a positive difference, not just for the people that we are serving on the site, but for Marion County as a whole. It's been really remarkable to see how quickly and how effectively people have come together to be supportive of this mission and have worked together so effectively to make this a reality.
Thank you so much, Dr. Overly, for this work and all of the work that you're doing to help individuals with mental health needs. We certainly owe you a huge debt of gratitude.
Thank you. It's our pleasure.
As we enter our second month of this program, we have quite a few lessons learned. One of the most important for me is that a risk for homelessness when asking people to isolate at home is also an important factor to consider, as Dr. Overly just shared with us. And because of that, we recently broadened our criteria to include people experiencing domestic violence, those living in group or congregate homes with substance use disorder, and those with intellectual or developmental disabilities at several sites where support staff are available. We've also found that our Safe Recovery sites can learn from each other, and just today the first statewide call took place so that lessons learned and best practices could be shared among each of those sites. So I'd like to close today with just a few stories that really illustrate the why of this work. The first is a primary care physician who is staffing and consulting for one of our facilities, and I'll quote him directly. He said, "I've been consulted on about 20 separate clients at safe recovery sites. Anxiety for these Hoosiers is already off the chart. Isolation has likely made already existing anxiety worse. Any site like this should be staffed with people trained to have those conversations. Nurturing people who are alone in rooms takes time and expertise." He says, "I have started or restarted 6 people on Suboxone. One was brand new for the first time with an existing heroin addiction. 2 were in treatment, but their program was no longer available due to the pandemic. The rest had left their programs, and for them, this was another chance. One of these clients called me back after discharge from the safe recovery site. He said, 'I was so angry in the beginning, but that program saved my life. Thank you for saving my life.' I have also had a number of people tell me they are thankful. I've had a number of people tell me that they felt safe at the site. I'm not aware that we've sent anyone back to the hospital for worsening COVID-19. He also said, "I would like to think that we should all reflect over what would have happened if we had not had anywhere to send people when our homeless neighbors tested positive in shelters in downtown Indianapolis. By taking care of the most vulnerable, we take care of all of us." I'd also like to share at the Safe Recovery site, clients are getting phone checks every 3 hours to find out how they're doing. The staff at the Safe Recovery site are checking on their medical and mental health needs, as well as finding ways to make their quarantine better. Doing these kinds of intentional, deliberate checks, we've been able to discover and begin treating unrelated medical conditions as well. And lastly, the Safe Recovery site has allowed for families to quarantine together. A mother and her 2 children have been able to find respite at the Safe Recovery site here in Indianapolis, and the mother and the staff worked together to ensure that the children had all the items they needed to make their quarantine safe. The chef at the hotel even worked to provide special meals for the children, and this family successfully was discharged to a home from the Safe Recovery site. Programs like this are important while we transition from a global stay-at-home order to targeted stay-at-home through mass testing and contact tracing. Helping individuals and families safely isolate to continue flattening the curve is one of the roles FSSA and other social services community organizations will continue to play. We must keep caring for individuals and people that need additional supports as we reopen. COVID is a reason to do things differently and better when we are recovered, not just while we are in crisis. I remember vividly the first disaster medicine lecture I attended at a national conference. It was a long time ago. It was about how vulnerable populations are affected in a greater magnitude by disasters, no matter what kind, natural, economic, health, or otherwise. The speaker emphasized that these individuals and communities must have someone watching out for them in disaster planning. I hope that in the final judgment of this, we gave it our best to be that someone. Thank you.
Thank you, Dr. Sullivan. Next, we had a question, I think it was yesterday or maybe the day before, from the Louisville metro market, Floyd County, Clark County, asking about how our bordering efforts affected our rollout plan or our reopening plan, our re-engaging plan. And so that got me thinking a little bit, and I thought we'll just reach out to some folks who have been doing this for a long time, long before COVID-19 ever arrived on the scene on their border or ours. And so we reached out to 2 real economic development, Chamber of Commerce leaders, both in northern Indiana, southern Indiana. And the first up, we've got Jeff Ray, who is the president and CEO of the South Bend Regional Chamber of Commerce. Jeff, we go way back. I knew you in a different life when you were in a different post, the mayor of Mishawaka. But for some time now, you've been leading quite an organization up there. And we used to talk about the hot spot up in the South Bend area. Now hot spot's taken on a different definition. But you all have been hitting this hard from day one. You've got a lot of primary duties, but one of your collateral duties that you've just assumed is you've been described to me as the COVID czar up there. So if the health department, the local health department needs a testing site, or if businesses need to find equipment to make ends meet, to better and more safely reopen, it's you that is making that connection, and you've got a lot of business. I think you have like 1,300. I was at a lunch with you not too long ago, and you were about 1,300 member businesses that represented about 70,000 employees up there. So thank you so much for what you're doing now, what you've been doing for a long time, and thanks for joining us today. And if you would, I'd just like to throw a few fastballs at you and just talk from your heart about what's all been going on up in your neck of the woods, how it plays on that border. But how are businesses in your area, what's the sense you get from them about reopening at this time?
Great. Thanks, Governor, for having me. Really an honor to be here. Appreciate it. We were both much younger way back when, and appreciate the friendship through the years and the chance to be with you today. The Reaction Friday to the Back on Track plan has been really exciting. This has been a devastating economic crisis for many businesses in our area, at the same time as it's been a devastating health crisis for those families that have been impacted. And businesses have really operated with some uncertainty for a little while in terms of when they might have a chance to reopen again. So as Dr. Bach said, kind of a measured approach here where we now have a path to reopen, I think is on track. And so many of them jumped right on it. Many of them had been working on their playbook, their plan, how would they react? Businesses really have two priorities right now. How do I keep my employees safe? And how do I keep my customers safe? And they have been thinking through that, and thanks to the advice of your talented team of health professionals and ours here locally, I think they now have some clear direction and are able to open in a manner that, in that slow, measured approach, but in an approach that we hope keeps everybody safe and long-term limits the spread of the virus.
Could you, Jeff, just share maybe a couple of your secrets with the whole state about how you're specifically connecting, when you're helping these businesses navigate to make that ultimate decision whether to open or not to open or when to open, how are you connecting with them? Is it different than before, or have you added new ways that you never anticipated?
Yeah, it looks a lot different. I think in the past, we're a member-based organization. That was our focus. Our focus now is really on the whole broad community. So how can we connect them to the resources that help them navigate? So things like the PPP program, the CARES Act, the EIDL loans, those pieces of business assistance on the front end. And then on the back end, as we recover and we start opening the economy, it's how do we connect them to things like PPE? Where do they find masks? Where do they find hand sanitizer? We're thrilled that today the state has launched the PPE marketplace. We think that's going to be a great resource for our small businesses. But we're really trying to get our businesses to reimagine, think differently about what they're doing. So I'll give you an anecdotal story. Indiana Whiskey, who makes some great whiskey here in South Bend, I'm told, but they're making hand sanitizer for now. So as our businesses are struggling with where do I find that kind of stuff, they're finding it at businesses like that who are navigating their business to meet a critical community need. And I think that goes on down the line, whether it's folks in their households making masks, whether it's businesses who have repurposed to make masks or PPE, whether it's the university who's printing shields for our medical providers. A lot of folks have adapted in a different way. And I suppose, with us, what we're trying to do is just leverage those relationships. You mentioned we have about 1,300 member businesses that are part of our organization. So we'd like to think that we have connections in about every industry. And so even I'd say sharing that best practice is a really critical piece of this too. So again, the small restaurant may not know what to do to sort of put that plan together. And so the benefit of some of those other restaurants in town who've already put that playbook together, they can help give some advice. It's interesting because I think it's a bunch of Hoosiers working together, right? They all sort of compete to some levels, but right now, as you've mentioned many times, we're all in this together. And I think people have taken that to heart and have worked really hard to try to help their neighbors and help their friends and help their competitors get on the right track.
Yeah, that's been a beautiful thing to watch, all these Hoosiers out there competing to do good, and it's really raised all of our games. You alluded to this, Jeff, but it's probably somewhat of an advantage in your region. I mean, your healthcare workforce or sector is one of your largest employers, and you touched on that. Is there anything specific, though, that's that's different about that sector with all the advantages that it brings? How are you helping them in this time, being that, just a sector of experts, if you will?
Yeah, obviously we're meeting with them every single day, and this has been difficult on them as well. So as they prepared for potential surges, they haven't had the capacity in the hospital for the normal stuff that they do. So it's had a significant financial impact on them as well. But they're out on the front lines and they're testing every day. And when we've identified particular parts of the area that maybe don't have the testing they need, they've mobilized quickly. They put their mobile units out. They sent their docs and their nurses out to do testing on different areas. And so they have responded, day and night, trying to figure out sort of how to make sure our community is prepared for this. I think they've done just a lot of on the education front too. Obviously there's a lot of news and information out there, and we're actually on information overload sometimes. But to hear straight from the people on the front lines about what they're seeing and how we as a community can help them, I think is really critical. And then the final piece with them too is just trying to remind our community that even though COVID is here and it's obviously a really serious thing, there are other pretty serious medical issues that people are facing. We don't want them to avoid the hospital because of a fear of the COVID virus, and so people need medical care. And so, so I think there are a lot of efforts just to help remind people that to don't put off that needed medical procedure or whatever just because of that and get back to the hospital. So, they're the captains of our team, our effort. The local hospitals, the health department are all doing a really fine job helping lead us through this time.
Yeah, you mentioned, and Dr. Box had a conversation with Dr. Mark Fox earlier. That was last week, I guess. It's blurred. And you're blessed to have Dr. Fox up there as well. But someone described you to me as the COVID czar. Can you tell me what that means or how you earned it? You probably didn't see that pitch coming.
No, and I totally think that's my buddies that kind of give me a hard time about this more than it is anything else. Again, Dr. Fox and the talented people at the health department and our medical systems, much like on your team, the talented team you have with Dr. Box and all the people around it, they're the captains. The effort, my effort really was to try to help connect several spots. You mentioned I used to be an elected official, so I'm really serving as the representative of the mayors, the county commissioners, working with the city councils, kind of all the elected officials. I'm bringing the voice of the business community. What we're trying to do is just leverage the relationships we have with folks to make sure that we really are all pulling in the same direction and working to try to help us as a community get through this. So I'm kind of have put a few of my chamber responsibilities on hold to devote full time, because we know we really can't get out of the economic crisis if we don't fix the health crisis that goes along with it. So we've tried to play a role in whether it be helping a test site or Dr. Sullivan was talking about isolation quarantine facilities. We've worked with our hotel partners to find a facility to do that. And so overall, I couldn't be more pleased with the team effort we have here, the organized team, and again, with the leadership of folks like Dr. Fox. I think we're doing really well up here.
Jeff, you're going to be able to stick around to answer some questions at the tail end of this hour?
I sure will.
Thank you, Jeff, so much for your sharing your experience and your wisdom. Next, we're going to go down. We're going to stay in the state of Indiana, but we're going to get as far away from South Bend as you can possibly be and still be in the state of Indiana. We're joined by, I see her now on the screen, by Wendy Dant-Chesser. Wendy, so good. I'm not stalking you. I know we've been talking a little bit here lately, but thank you for also joining us. Wendy is the CEO and the president of One Southern Indiana, another massive economic development and Chamber of Commerce representing Clark County on this side of the river, Clark County, Floyd County. So you're constantly working with Sellersburg and Jeffersonville and New Albany and Charlestown, as well as that Louisville area on the other side of the river. So it's just one big metro area. A lot of experience doing that. We just thank you so much. And I don't know if you caught part of that conversation with Jeff, your counterpart up north, but can you talk a little bit about, everything that you've been doing for months and years that has led you to this moment? So it's not exactly seamless, but it's not new, that these conversations and relationships.
Governor, thank you for the opportunity to join today, and thank you, Jeff, for giving some of the previews to some of the things that we're doing as well. As the Indiana counties that are part of the Louisville metro area, we're best known for a city we're not and a state we're not a part of. So if you think about a little tongue tie there, but if you think about how that plays out, a lot of the pull, a lot of the television media that we get comes out of the state of Kentucky. So we have to think about how an Indianapolis or a decision made in Indianapolis affects us. When we first started into the stay-at-home phase and businesses were scratching their heads figuring out where to go from here, our role as the One Southern Indiana Chamber of Commerce and Economic Development organization was really to provide resources for them as well. We don't tell anybody how to run their business. Instead, our goal is to get them the best information that we can so that they can make the best decisions for their businesses today and in the future. We too put up resource pages on our website, which is what a lot of folks did. We also reached out and asked members and businesses throughout the area, what do you need? What's the immediate need that you have? And that question comes up, the answer to that question changes, so we continue to ask that question. Based on what they said that they needed from us, we were coordinating calls with experts daily. We did this daily, either on Facebook Live or through a Zoom webinar, an opportunity for businesses to ask an expert questions. We, early on, a lot of questions from HR attorneys. How do I do this? What's the appropriate piece on this? We then got into talking to a lot of the CPAs in the area, talking about the Paycheck Protection Program and what that meant and what those expectations should be. We talked to restaurateurs now that they were going to curbside service. How was the best way for us as consumers, but also as them as businesses to figure out how to do that? And finally, even mixed it up a little fun. We had a sanitation conversation came up, and we pulled in the guy who runs the porta potty company, because if there's anybody who knows anything about sanitation and keeping things clean, it was him. So he was able to give us his insight on that, and it really did help the businesses. Governor, you've talked a little bit, and Jeff just alluded to this as well. Huber's Winery in the Starlight Distillery, they converted very quickly to making hand sanitizer as well. And the public story is that about 5,000 gallons has been made and given out to help individuals deal with this because they couldn't get hand sanitizer. The backside of the story is we also were able to ask businesses what they could do to help. And because of the main products of glycerin, or the main ingredients of hand sanitizer, the glycerin, the hydrogen peroxide, some of the whiskey bases that they were using, those main ingredients, other companies pitched in and took truckloads of those ingredients to help Huber's get to the point where they were making the hand sanitizers. So the story is really a 360 story. There was a need, there was someone who wanted to make a difference and fill that need, and then they called in for help from other businesses that made that possible. So we're all benefiting from that.
Great partnership, another theme that is emerging daily. Can we turn our attention to Washington, D.C. and all the help our congressional delegation has been in terms of funding, but it's really pronounced, and you've been a part of some fundraisers for local efforts there. Can you talk a little bit more about those programs, whether they be loan programs or helping folks raise capital or funding that they need, as you say, right now?
When this first started and businesses had to close their doors or shift gears so rapidly, the biggest thing that they were concerned about was cash flow, and because they were burning through their cash so quickly. So we looked at our partnerships around the area. We have an existing partnership with the Caesars Foundation of Floyd County. We run a revolving loan fund that Caesars has had in existence for a number of years. And we were able to allocate $30,000 to an emergency loan program. We thought, wow, if we can give this out to some companies that need it, we'll be making a difference. That really was that snowball effect. And once we started with that, we ended up raising a total of about $426,000 for emergency forgivable loans. These were the ones that went out very, very quickly. I think we expended all the dollars to about 44 businesses in maybe 6 or 7 business days. A remarkable turnaround. but that didn't fill the need. So another donor came forth and said, we want to do something a little more significant for some of these businesses, those that are public facing. They add the cultural flair to what the businesses are looking for, and or what our communities are, and how we define ourselves. So the second effort raised about $550,000 for zero interest loans to help those companies that really define the culture and character of Southern Indiana keep their doors open. So when we looked at it, we had about $976,000 raised in a short amount of time that are helping over 70 small businesses in Clark and Floyd counties. A lot of those businesses don't have the access to the payroll protection program, or they don't have the relationships, or they weren't as certain of what they needed to do with that. So these emergency funds really hopefully have come in and given them just enough to get them to the next phase where they can start to reopen their businesses.
Yeah, two more quick questions, if you will, and then I understand you're going to be able to stay with us as well to answer some questions on the second half hour.
Yes, sir.
So as you see businesses start to open or reopen, some were open this whole time, do you see your life changing, your day-to-day business changing, or is it going to be very similar from here on out?
Oh, every day is a new year. Yeah. So when we're looking at the businesses that are going through the reopening phase, their crystal balls are as cloudy as ours are. What is it that they need? Until they actually get into it, they're not sure. They have cautious optimism. They know that they're looking forward to getting back to normal, whatever that means for them. But they have hurdles that they are raising their heads every day. So is it personal protection equipment, as Jeff mentioned, masks, thermal scanning? We as an office setting, we've never had to do that. We've never worn masks or taken temperatures or asked people health questions. What do we do? How do we do that? Other issues businesses are talking to us about is how do they bring employees back from furlough? Who do they need first? How do they protect the workforce that they have that is considered in the vulnerable category because of pre-existing conditions? And how do they bring people back and protect them without being discriminatory? So there's a lot of different questions that businesses are asking as we talk about, or as we ask them what they need from us and where we go from here. What that is doing, finding the answers to those questions is creating the work plan for our organization. What are we going to pivot towards, or how nimble can we be so that we're going to ensure that we're getting those businesses the relevant information at the time that they need it.
Right. Can you just spend a couple minutes talking about your relationships in Louisville, in Kentucky, because you are one metro, so your health department swapping information, elected officials swapping information, people going to and from work or shopping or dining on both sides of the river during normal times and now during this time. Can you just talk about how unique that is, being on a border?
Well, we have spent many years working to create more of a regional approach to things. It's really easy during good times to start thinking regionally. What we found is that we had to keep that effort front and center as we've moved through this crisis phase. But I think we're getting there. There are opportunities for folks to look at what it is that's going on the Indiana side of the river and think about what that means for the entire region. I know that Kentucky's governor is allowing some businesses to open next Monday as well. So as those businesses are getting guidance from the state, we can share best practices. They can look at what we're doing. There's a little bit of an opportunity for us to do it right, and I'm thrilled that our businesses have taken that cautiously optimistic approach to trying to make sure that they're doing things right as opposed to just doing things quickly. And we hope and will continue to build that bi-state cooperation that we have been working towards for many, many years.
Yep. Thank you, Wendy, and thanks for staying on the line as we get to the questions. Rachel, we'll get right to those, but I did want to say just very briefly that on Monday I mentioned that it was the National Teachers Week. It is National Nurses Day today, and never a more appropriate day than where we find ourselves in and what we're all dealing with. You think about the 150,000 nurses in the state of Indiana, not to mention all the retired nurses and all the folks who are stepping up and volunteering during this pandemic. And what's become very clear in my mind is, especially as of late, is just how nurses care about the entire patient. Oftentimes in the past, I just thought they were treating a symptom, but that has really broadened. And I just came across one story recently about Diana Smith at Duke's Memorial Hospital up in Peru, Indiana, and one day, like probably so many other days in her life or in the life of a nurse, she was working with a patient in the infusion center, and she just noticed that this patient, when he would come, even in the cold months, didn't have a coat on, didn't have long sleeves on, didn't have the kind of the proper warm clothing, and he was walking very long distances to the infusion center. And on her own, you know the rest of the story, you can fill in the blank, bought this gentleman a coat. And that one act of kindness led to another and another and another, and folks would bring in clothing, you know, putting a shirt on someone's back. And you just see that happening. It's always happened throughout, you know, our state history, but you're really seeing folks step forward. And I just want to, you know, to say to Diana and to all the other nurses, thank you, to all the nursing aides. I mean, this is a huge team effort, and it goes way beyond the shift that you're on. The depth of our gratitude. This one gentleman, that act of goodwill and kindness not just changed his treatment, it changed his outlook. And that's what's happening every day. So, Rachel, with that, let's go right to the questions. But thank you to the nurses out there.
Whitney Downard, CNHI.
Hello, Whitney. Good afternoon.
Hey there, all you cool cats and kittens. I've got
right out of the gate.
Hospitalizations today. I wanted to see if we could get better hospitalization data by region, preparedness region, preferably by county, because we say that's one of the 4 pillars of reopening, but we're not seeing any data about that hospitalization on the county, and also ventilators and ICU bed units.
So we do have all that data, and we do look at that on a regular basis. So all I need to do is talk to my team and see if there's a way we can make that happen.
Your wish is our command, Whitney.
Yes. Yeah. They listen to the press report every single day, so I'm sure they've already heard this. And if it's possible and we can make that available, we'll do that.
Whitney, just let me ask a follow-up question of you, actually. You mentioned not just the hospitalization rates per county or region, but you also mentioned vents and ICU beds or COVID. Or what exactly are you requesting there?
That's another one of the, principles that we have is that ventilator and ICU bed usage, but we don't have that data on a region or county level.
Gotcha.
Meredith, WLFI.
Hello, Meredith. Good afternoon.
Hi there, how are you doing today?
Doing great. How about yourself?
Oh, not too bad. So my question has to do with the testing sites that have opened up today. We have gotten some reports from people who say that they, had an appointment scheduled for 11 o'clock, but they weren't seen until 3 or 4 o'clock due to some computer issues that you guys have been having. Apparently, that's the report that we received. So my question is, are you guys having any type of computer issues when it comes to that? And then they said that they question, the accuracy of these tests if you guys are having those kinds of issues. So what would you say to people like that? And then also, if people are waiting this long, how are you making sure that they're properly socially distanced and making sure they're all staying safe, since the majority of them probably have been exposed to COVID-19 patients or have the symptoms themselves?
Yes, accuracy and weight is two.
Sure. Very good questions. Thank you for asking them. Anytime you start something new, which we did today for the first time at 20 different sites across the state, there are oftentimes hiccups. I had not heard any hiccups with regards to the computerized system, so that's new to me. I do know we had a couple of sites that had trouble getting up and going this morning and having what they needed to do the testing. We whenever we're out working, whether that is in a drive-through testing area, whether that was for our recent study. If for some reason the computerized registration system or our computer's not working, we do that handmade, and that makes it a lot more difficult in the long run for us. And I don't know that we've had to do that, but we are very careful, understanding the fact that every test has to be, appropriated to the right individual so that they get the right test back. Now, from a standpoint of whether they were appropriately socially distanced, I know the sites were chosen to make sure that there was the ability to separate everyone as they're registering, as they're getting tested, and all this is being accomplished. So I feel fairly certain that we've done that, and I'm hoping that everyone is taking to heart the recommendation that as we go out in public and go into those inside spaces, whether they're retail or wherever that is, that we're wearing masks.
What about the accuracy of the test she asked about?
So the accuracy of doing the nasopharyngeal test is actually fairly accurate if you are symptomatic. If you're looking at someone who is asymptomatic, and we are now testing asymptomatic individuals, and we talked about that high-risk population, those individuals with underlying health conditions, those individuals that are among minorities, those individuals that have had close contact with someone that we know has COVID, that accuracy does drop off, probably into the 30 to 40, 50% range.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Good afternoon, Governor. I was wondering, are you guys tracking at all numbers on suicides, homicides, deaths at home to see if we are having more deaths overall in the state?
I think you're both.
We're on?
Yes.
So I'll start with the deaths at home and then let Jen talk about the suicides. We definitely track deaths at home. Those would be coroner's cases. And as you know, our coroners have been provided the ability to do COVID-19 testing. And so we are, just like with our drug overdose deaths, making sure that we are testing those individuals.
Thank you for the question. As you know, our death data that comes through Vital Records is delayed. It doesn't come through as a report every single day, but we do track hotline calls on a real-time basis for our suicide hotlines that are statewide. We certainly know that those calls have increased. We've increased the staffing and also the expertise for individuals that are taking calls through traditional suicide hotlines, domestic violence hotlines, our 211 call centers, and we also are tracking those reports through our Division of Mental Health and Addiction, and those trends are ones that have prompted us to really build out those systems for mental health supports so that we can get to people early. If you have any suicidal thoughts, please reach out immediately. Our community mental health centers are available for you 24/7, 365. Go to your local emergency department and do not wait. It's really important that you seek help today for that.
Dan Klein, Wish TV.
Afternoon, Dan.
Good afternoon, Governor. Mayor Hogsett came out today saying that he is keeping all churches and spiritual institutions closed in Marion County. Obviously, statewide, there's a different standard, which sort of leads to the effect that a church on the south side of 96th Street would be closed for the next couple of weeks, while a church on the north side of 96th Street would be free to open. And obviously, you're encouraging them to be socially distant, but could have 500 people. What are your thoughts about what the mayor has done, number one, and then number two? This is kind of in a lot of different industries. There's going to be kind of those types of, you cross the street and have that type of disparity, I guess, when it comes to restaurants, but, in this case, churches. What are your thoughts about that?
Well, not only am I not double negative, I'm not going to second guess the mayor's decision. I'm going to say it was the right decision for Marion County. Totally understand where he's coming from and support it. I'm not going to start erasing lines. There's a county line there. We polled Marion County. You got to stop somewhere. We thought that Marion County delaying it because of the numbers that we were seeing lined up with our thinking going forward. In terms of houses of worship, we believe that properly socially distanced with the proper hygiene protocol in place, that services can be conducted safely. Now, having said that, I still recommend, me personally, to live stream your service. I still believe those parking lots are even safer than coming in, but we do know that you can spread out. And what we didn't want to do was just do all the above at once. And so understanding the unique importance of our spiritual nourishment and guidance to our physical and spiritual health, we believe that we could take that step right now. But put that in Marion County, I'm going to support the mayor. Put that in Cass County, I'm going to support the mayor of Logansport. Put that in Lake County, I'm going to support all the mayors up in Lake County if they make a different decision. By the way, in Bloomington, in Monroe County, the mayor came to a different conclusion, fully support him. So this is, I talked about in the first week of this, that partnership was going to be key for us to sail through this storm, whether it was local partnership or federal partnership. And we are squarely in the middle, and we are going to stay there as we guide through this storm.
Kathy, Ferdinand News.
Hello, Kathy. Good afternoon.
Good afternoon. Hope you're all doing fine today.
We are indeed, and I understand Du Bois County is thriving, or you have a slogan down there that you're not just surviving, but thriving.
That's what we're going for.
Good.
And of course, this is the most beautiful part, I think, of Indiana. So I have a question for you, because looking at the calendar, and if I have this right, the state parks and forests can't open to camping until May 24th. And of course, that's Memorial Weekend, which is always, that's the Sunday of Memorial Weekend, which is always a huge camping weekend. And I wondered if that was intentional, or if you'd given any thought to open those state parks, state forests, and other camping facilities on the 22nd, sort of to allow that festive weekend people are used to.
Yeah, you said it correctly, Kathy. I mean, state parks are open right now. We did see in my guidance a couple days ago on Monday, or actually on Friday, we said that this was a roadmap. And we said that what happens today and next week and the week after will affect the path that we stay on, or the road that we stay on, our actions, our behavior. We did see a beautiful weekend this past weekend, and we saw a tremendous outpouring of activity at our state park properties. People understandably wanting to get out and breathe, take in the fresh air. Totally get it. But we have to make sure that we're doing this safely. And so in terms of camping at our state parks or campgrounds in general, we did put that off. I think it's stage 4. I'm looking out for stage 4, 3, stage 3. Now, having said that, what happens in stage 2 will affect stage 3, whether something is brought forward or pushed back. And so, again, all of these different sectors or different businesses, we just couldn't do everything at once. And so we're taking one step at a time to make sure that we complete this journey, we hope, in July.
Sherry with the Indianapolis Star.
Sure. Good afternoon, Sherry.
Good afternoon and welcome back, Dr. Box. I wanted to ask about something that I'm sure you guys at the State Department of Health noticed, which was 99 new cases in Hendricks County. And I'm wondering if you can address what you think is going on there and maybe use that as an example of how you will step in when you see something that's such a dramatic departure from the norm going forward.
That's a great question, Sherry. And when we looked at that, what we saw is that like 68 of those 99 cases were from the prison there in Hendricks County, and that was what was really contributing. So it was like 69% of the cases. So it's still concerning that the prison has that number of cases, and Dr. Doss is here, and if you would like her to comment more, we can certainly have her do that. But the important thing is that's not something we think is a community spread thing, as long as we're looking at anyone who works there and lives in Hendricks County and is getting tested if need be. Dr. Doss?
Yeah. Kristen Doss, Indiana Department of Correction. You're right, we do have a hot zone, so to speak, in the Plainfield area. We've got 3 correctional facilities out there, Heritage Trail, our male intake facility, and another smaller site, so IYC. So together, there's 3 facilities in that area. One thing that I will share with everyone is that in an effort to expand our testing efforts, to make sure that all of those who we serve have access to testing, we are testing every single offender who is in our intake facility. So whether they come from the county jail or from the street as a parole violator or someone like that, we are testing all of them. And I am just setting it out there that we probably will see those numbers increase. However, we are working closely with the Indiana State Department of Health, the local Hendricks County Health Department, and the hospitals. Hendricks Regional has been a great partner in the effort. So I think it's something we're aware of and on top of. And then while I'm up here, it's another special week. So not just teachers and nurses, but also it is National Correctional Officer Week. So May 3rd through 9th is where we say thank you to all our correctional officers. And quite frankly, we weren't able to do what we typically would do to celebrate our frontline correctional officers risking their lives every single day to come into a facility and protect us all. But I think up here having the minute just to say thank you may go a long way. So thank you from myself, Commissioner Carter, and the rest of the IDOC team.
Thank you, Dr. Dawes.
Our final question is from Justin with the Westville Indicator.
Hello, Justin. Good afternoon.
Good afternoon, Governor. I have 2 questions for you guys today. Firstly, the total number of ICU beds that's available and in use has declined from 3,325 on April 26th to 2,736 today. Total ventilators have declined from a high of 3,215 to 3,091 today. Could you explain what's happening there? And the second question, some local fire chiefs are wondering, will state funding be made available to volunteer fire departments in the future to aid in purchasing PPE and other necessary equipment due to the pandemic?
I can start.
Vince or ICU bed? Yeah.
Sure. Justin, I'll start. So when we look at that, some of our hospital systems are actually kind of standing down their emergency response in their hospital systems so that the number of ICU beds that they're technically listing is actually going down a little bit. Also, the number of ventilators that they have taken and kind of repurposed and planned to use in the event of the need of an excessive amount of use for ventilators has also declined. So I think those are the 2 things that you're seeing there. Rest assured, we still have that ability within our state to increase the number of ventilators and ICU beds as needed.
And before we go to Dr. Sullivan and then to Chris, but as you said at the outset, our ventilator availability is still 79, 80% and has been for quite some time.
Absolutely.
Yeah. Want to comment on that?
Absolutely. Dr. Box is correct. In the surge planning, we pulled everything that we possibly had into those numbers to make sure that we had a view of the entirety of our capacity. And as we move to open urgent procedures and those ventilators need to go back to operating rooms, et cetera, they come out of the surge numbers and back into regular everyday use. But they're still there, and our hospital systems have shown incredible leadership and can turn those back on at a moment's notice.
Chris, you want to take the second part of that question?
Chris Johnston, Director of Office of Management and Budget. And as far as PPE for volunteer fire departments, yes, they would have access to not only the marketplace portal, marketplace for PPE that Luke Basso discussed yesterday from the IEDC, but then also the $300 million allocation towards local units of government and local application. We would include volunteer fire departments working probably through their townships and then up through the county organizations for that use.
Thank you, Chris.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be tomorrow at
Governor Eric
2:30
Holcomb
p.m.
and state
Eastern.
leaders giving us an update on the coronavirus pandemic across our state. I don't know if you were able to hear me there. You were listening to Governor Eric Holcomb giving us that update again. 862 new cases across our state as of this morning, with 51 more deaths reported. If you want to read more about that, head on over to wishtv.com. Of course, we'll have much more on what came out of today's news conference coming up at 5 and 6. Mike and Anessa will be back with you at 4 for All Indiana.